Well, thanks for tuning in to the Zelos Podcast. I'm your host, Rocky Snyder. This is the show that's all about the pros behind the pros. And I'm digging back in time into the archives because I had a conversation with Dr. Emily Splichal of Barefoot Training Academy. And it just so happens Emily and I are going to be part of an 8-week webinar kicking off in February with Bill Parisi of Parisi Speed School. The three of us are joining together for 8 weeks of webinar information. So why not go back in time and revisit this conversation I had with Emily? Now, before we get underway, remember my website, rockysnyder.com, is a place to go for online, in-person, continuing education. We've got the podcasts, the archive. I mean, we've got 250 episodes by now, 5 years in the running, 20 seasons. It doesn't get much deeper than that, folks. So check it out if you've got some extra time. And let's hear from the sponsors, and then we'll get right into the show. This episode of the Zelos Podcast is sponsored by Kinetic IQ, where intelligence meets motion. Kinetic IQ brings a biomechanics lab into the palm of your hand, letting you measure movement anytime, anywhere, with just an iPad or an iPhone, and no wearables required. I've been using Kinetic IQ's markerless motion capture in my own practice, and whether you're screening athletes, analyzing posture and gait mechanics, optimizing performance, or guiding return to play, it helps practitioners like us save time, capture more objective data, and make instant actionable decisions. So to learn more about how Kinetic IQ is shaping the future of intelligent movement, visit them at kineticiq.com. That's KINETIKIQ.com. You know, I can't tell you how thrilled I am to have Metabolic Elite be one of the sponsors of the Zelos Podcast. You know what makes Metabolic Elite different is their commitment to real results. I've seen a lot of supplements and performance enhancement things over the years, but they pair clinical experience with innovation, like Lipitab, their proprietary solid-state liposomal delivery system. It's a chewable format which enhances absorption like nutrients like BPC 157 and synapses. They're delivered more efficiently in the body, supporting recovery, focus, cognitive health. Their formulas go beyond the basics, solving performance health challenges at the system level. Every product is tested for quality, it's backed by research, it's trusted by athletes and clinicians alike. So learn more at metabolicelite.co. And you can get 10% off all of Metabolic Elite products by entering the coupon code ZELOS, Z-E-L-O-S. And before we get underway, be sure to follow us on Instagram at Rocky_Snyder, S-N-Y-D-E-R. Click subscribe, give us some comments, tell a few friends, enjoy the show. Well, first, welcome on.
Thank you so much.
My pleasure. You know, I've got to say, with all sincerity and honesty, you are the very first podiatrist that I have met, that I have had conversation, and more will follow, who knows that life exists above the knee. I don't know how else to say it. I don't want to slam podiatric? Do I say it? Yes, podiatric medicine or podiatrists in general. But I've got to say the ones around my community, every time I talk to them, and I geek out on the foot like everybody that's been following these shows knows, but the podiatrists say, tell you what, one actually said this to me, tell you what, I love what you're doing here in your studio. You take care of everything from the knee up and let me deal with the knee down. And I just kind of like my jaw didn't physically drop, but it wanted to. I'm going, okay, so right, I just want to get into the nitty gritty here. With your studies, how is it that you're so different that you actually know that there's something above the knee?
Yeah, so one, I hear that a lot. I am probably a very large black sheep within the podiatry community as how I look at the foot from an integrated perspective. I would say it's not necessarily the faults of all the other podiatrists because we know what we know in a sense. So what we're taught in podiatry school or medical school or chiropractic school, that's kind of what the majority of those professionals will learn or use when they're considering medical decisions, let's say. I look beyond the foot, partly because I came into it with an athletic background and a fitness background, which again wouldn't necessarily have to connect the dots or bring you outside of the foot. But what I did is a very non-conventional path that I started in sports, fitness. I was a competitive gymnast, started training and teaching classes. So I was in fitness. Then I went to medical school, kept teaching classes and training clients all throughout medical school. And then when I was doing my residency, I actually took time off and went back to school to get my master's in human movement. And then that's where I learned a majority of what how I look at movement now, and was able to connect the fitness here, the podiatry here, and then the middle is really my master's in human movement. So that's what I think is what opened that up. And then it had to be a foundational curiosity and passion to continuously learn. I'm just fascinated with the human body and kind of being like a little detective that, you know, you have to continuously explore different facets or layers of the complexity of the human body. So I think that it was a combination of all of that.
That's fabulous. I had no idea that you were a gymnast. I was competitive gymnast myself. I didn't do the uneven parallel bars. I did it once, actually. I did it, but then they kicked me off and they said, no, the high bar or parallel bars, more your suited, your style. But hey, what's really I want to know is, like, you do say black sheep, and in a way, I think that I won't say I'm out on the fringe with the approach that we take with strength conditioning here, but it's definitely not the conventional, traditional way in which we approach the body. And I think a big part of it is the backgrounds that the non-conventional way in which we learned, and breaking away from, I won't say dogmatic philosophies or information, but the things that are repetitive over and over from one semester to the other without necessarily questioning the validity or the accuracy of the information they're actually teaching. So while you're doing these studies and you're learning that, wow, when the foot pronates, it actually has a reaction up through the chain, into the knee, the hip, the pelvis, the spine, all the way up through the head. In fact, we can go out the wrist for that matter. At what point in time did the teachers in your class just kind of just scratch their head and go, no, that's not what we're learning? Or at what point in time did you go, but you're missing the point here? Did any of those, did those events occur with you?
Yeah, so I had to really connect the dots outside of school, where in traditional, you know, the medical school setting where we're learning biomechanics and sports medicine and things like that, it was very isolated. You know, patient never gets out of the chair. What's quite fascinating is, I don't know how you do orthotics without doing a gait assessment, but go figure. That's the way that it was taught. And then maybe there was a little periphery mention of the psoas at some point. But if I asked, you know, every single person that I graduated with, maybe 2 people will remember where and what and how the psoas works. So a lot of that, like I said, was me going outside of this podiatry setting. I think that all professionals should go to conferences and educational opportunities that are not taught through the lens of their specific profession. So if someone is a physical therapist or a chiropractor or strength coach or whatever it is and says, oh, I know feet, you know, I studied under, you know, Joseph Pilates himself about feet or whatever, just to have a different perspective. So I try to say that my perspective is from a movement specialist, a fitness professional, being an athlete myself, and then over that is the podiatrist. So the clinical, you know, minutia of what we study and the pathology that we study. And then how can you take that and apply it to your specialty or your lens to just kind of factor it in. So a lot of the appreciation for pelvic floor, diaphragm, things like that is studying under, you know, Thomas Myers, James Earls, you know, all Diane Lee, like all these other, you know, influencers and educators and professionals in our industry. And I learn, not quietly, but, you know, quietly is the podiatrist over here. And they're talking about the body, not referencing the foot at all. And then I try to make that connection. And that connection is how I speak of it. And then that's really the foundation of my education company.
Perfect. Now, you've had mentors in the past, but all movers and shakers within our industry always have people they're studying under. And so I'm curious, like, what path are you on right now? Where do your curiosities take you currently in regards to your learning?
Yeah, so I'm on a different track. People are usually surprised when they hear this. I'm very much fascinated on fascia, but a different element of fascia. So more the emotional side of fascia. So interoception is something big that I'm studying now and try to incorporate into my practice and our education, but then also really biopsychosocial. So you can see I'm kind of in this, almost if you look at like, do you know the hierarchy of needs? And people
Yes.
get like, right, you
Maslow's.
eat like food, right? And then you essentially go, and the highest level of that hierarchy is really like spirituality. And I feel like since I've been in the profession for a period that I don't want to age myself, but long enough, that I've kind of worked through those different ladders of what is fascinating to me, or more higher complexities of humanity in a sense. So I wouldn't say that it totally goes to the spirituality side, but it makes me go into biopsychosocial and interoception, that when I look at movement disorders and movement dysfunctions and chronic pain, I can't help but factor in their emotional association to that pain or to that movement disorder. And then that has to be factored in. That might be something way too heavy for certain professionals, and they just want to talk about, trigger point release and, large joint movements and power output and, things like that. And that's totally fine. It's just where my evolution in movement and humanity and feet and fascia has taken me, is in that direction.
It sounds fairly Eurocentric in terms of the philosophy or approach. I mean, what I mean that is that I am imagining, and tell me if I'm wrong, but the majority of information coming about emotional health, well-being, the connections of the emotional body to the physical realm are much more either Asian or European. They don't seem so Americentric. Where's the information that you're discovering? Where's that coming from?
Yeah, so there's a little bit of research in this around Robert Schleip, who's a fascial researcher. He's mentioned it some. Ida Rolf, if you look at some of her historical publications, she speaks very much about the influence of fascia emotionally and kind of how we hold on to things. And then Dr. Gabor Mate, who I'm not sure if you're familiar with him, he is a Canadian physician who specialized in addiction, and then he started getting into the psychology of emotions in the body and things like that. He has a book that he wrote called When the Body Says No, which is an incredible book. I highly recommend it for you and for all the listeners. That it's just kind of like energy, and if you're not releasing energy or owning up to certain emotions within yourself and your world, it manifests itself somewhere within your being, meaning like cancer or autoimmune disease, things like that. So those are some of my main influencers right now. And I would say that if people think that I'm way out in left field, I'm actually not, because when you start talking about breathing, breath diaphragm, which is a whole trend and craze within our industry right now, breathing is essentially someone's manifestation of their autonomic nervous system state. And my autonomic nervous system state is really built around, do I feel safe or not safe? That's personal. That's me as, Dr. Emily Splichal. Do I feel safe in this moment? And my interpretation of that is based off of my past experiences. So that's where I feel that it has to be appreciated and respected within our industry to a higher level.
Yeah, there was a philosopher back in, I think, the 1800s by the name of Herbert Spencer who was coined the phrase contempt prior to investigation. And so for anybody that thinks you're out in left field, so to speak, then it's just because the information hasn't been gathered enough for them to understand. But I completely get it. There's many times where I'll be working with a client and there'll be actually a physical scar on their body. And we will be doing just basic range of motion assessment on one area and notice a scar. We'll palpate that scar and then reassess, and suddenly they've got a greater amount of movement. Now, granted, this is a physical scar that has a direct effect on the ability to move, but there's many different types of scars, and psychosocial, emotional, physical, these are all elements that can restrict us. And of course, you would know instantly if you just caught your breath, if you just breathed in and out, what is the quality of your breath like? So if you are feeling restricted, what does that say about the rest of your own movements? So we do a lot of looking at breathing as well. It's definitely, like you say, it's kind of like the haute couture. It's what is in these days in the world of fitness. And before that, we were looking at the transverse abdominis or the multifidi. Now it's the diaphragm. It seems to be that we spin the wheel every few months and we land on a new muscle or a new organ or something that we have to focus on. But all along, the way I say it is that we can go without water for a few days. We can go without food for weeks. We can go without oxygen for about 8 minutes before all hell breaks loose. And it was one of the first muscular contractions that we needed to perform when we came out of the womb. So to discount anything about breathing or diaphragmatic work just is nothing short of ignorant. So it's really, what I'm really loving is that you've broken away from the strict barriers of being a podiatrist and just having your only tool become an orthotic. And I can't tell you how refreshing it is that you only brought up the word orthotic once in the time that we've been talking now. But I feel like I need to bring it up because I know there's a time and place for help. Every time there's always a need to help somebody move better and so on. And I believe there's a place and time for an orthotic. However, when people come in and they've told me they've had orthotic cast about 4 years ago or even 2 years ago or whatever, and they are still wearing it, I have to say I've got some reservations about that because their body's always in flux. They may have gained weight, lost weight, had an injury or whatever, but the same orthotics are underneath them. I would love to hear your opinion on orthotics and tell me I'm full of it or whatever. I don't know what I'm saying, or say, give me something else. What do you think about orthotics?
Yes. So,
podiatrist.
Yes, a podiatrist. I actually consider myself a functional podiatrist, which I just made that word up, you know. They have functional medicine doctors, so I'm a functional podiatrist. So having said that, there is a time and place or conditions and foot types that actually do need orthotics. So I never try to make X equals Y or black and white statements, right? Like definite, because there's so much gray or minutia in between, or it depends. Choose what words you want to use with it. But that's how the human body is. So having said that, those that need orthotics, I try to still integrate foot strengthening and sensory stimulation. I try to get them kind of out of the orthotic at certain points. Someone who has a severe, rigid, overpronated foot with, osteoarthritis of the subtalar joint, the ankle joint, the tailor, literally the whole foot is essentially just arthritic and almost fused. That foot is extremely painful. And I know you work with a lot of seniors, is we have to appreciate the ideal foot movements, which would be, in my opinion, not in an orthotic, but there's certain foot types. And as we get older, unfortunately, certain stresses of repetitive, the foot does start to break down a little bit. It does start to become a little bit more arthritic. So one, appreciating the role of orthotics and restricting movement in those feet. If you have a client with severe arthritis and it's very painful and you try to bring mobility to that foot, because you think that the more mobile and then you get strength, you can actually be increasing their level of pain significantly. That from a podiatry perspective, and I do agree with it just from actual patient care, is when you have a severe arthritic foot, you have to lock it down. It essentially gets braced. This is why the surgery would be to fuse it, because you do not want those joints to move. And there's so many little joints that can move. You need to essentially lock it down. Counterintuitive to what we're thinking as movement professionals and coaches. But your priority in that situation is to control pain. So kind of summarizing that with orthotics, there's a time and place. Can you use them maybe transiently, meaning getting them out of pain while incorporating foot strength? Or do they actually really need them because of a severe arthritic foot or a whole midfoot collapse? And then even at that, could you tie in sensory stimulation?
So in an arthritic situation where you're trying to dampen the movement, you would put an orthotic in to do just that, rather than seek out the approach of fusion. Is that what I'm hearing you say? Or are you saying that?
Correct. Yes. If they had surgery, if someone had severe arthritis in their foot, or I'm talking midfoot, rear foot, ankle, right? It's quite extensive when you get people who had, and this is the person that would happen to. They were, 18 years old, maybe even a child. They had severe overpronation and they like total flat feet, duck feet, turned out feet as a kid. Now they're 30, 40, 50, and they technically should have been in orthotics, but they didn't want to. So they stayed in Vivo Barefoot or Vibram something, and they just didn't have the structure to support their foot. And they just wore down the cartilage. Now they're 70 and they have severe foot pain. That patient, you would say, you could go for a total fusion. Like they essentially it's called a triple arthrodesis. They essentially fuse the midfoot, subtalar joint, calcaneocuboid joint, or you lock them down in a brace and an orthotic. An orthotic probably isn't even enough control. They might need a brace.
Okay, yeah. This is totally against all of my kind of thought process. So you're right. It's completely counterintuitive, and I'm going to need to sit on that for a little while, because I'm going, wow, 33 joints. There must have been some movement somewhere amongst all 33. And now we're going to go on lockdown. It's interesting. So this is a very interesting kind of conundrum that I'll often run into, and not so much with yourself. I mean, you're just describing what the traditional or conventional approach is, but just that, and it's the orthopedic community where surgery is selected sometimes as the means of it and to an end. But in truth, I don't know. I'm still, I guess I'm going to scratch my head a little bit further on that one, but it's great that you bring it up. So with that, let's just take an individual like that who has collapsed and is completely everted in the rear and forefoot, and they're just going inward. How does that relate up to the pelvic bowl or the pelvic floor? Because it does have a direct effect. What would you typically see?
100%. So when I do trainings or even for patients, I will have them stand up and I'll have them, if you can picture, these are my feet, roll from the outside of the feet to the inside of the feet. So they're essentially just supinating and pronating their feet, right? So that they can move back and forth. And then as they do that, they should feel that their knees are rotating in and out. And everyone, if people who are listening want to just stand up and roll outside, inside on their foot, you will feel, just look down and you'll see that your knees go valgus and then varus, so they internally rotate, externally rotate. And when you do that, because everything is connected, that the foot is rolling in, as an example, you should feel that your knees are going inward or valgus. And then because your femur goes all the way into the pelvis, your pelvis is going to go anterior. So you get eversion, internal rotation, anterior tilt of the pelvis, and then the opposite motion is supination or inversion, external rotation, and then your pelvis moves more into a posterior position. Where this becomes even more important to appreciate is that when I have an asymmetry, so if I'm pronating on one side of my body, so now I have one side that drops in, internally rotates. So now instead of my pelvis going forward as a whole, I actually get this obliquity in my pelvis that one ilium rotates forward. And when it rotates forward, it goes a little bit in. And then that can create a whole myriad of issues in the pelvis, in the hip, in the SI joints, in the knees, in the feet, in the T-spine, really everywhere. Like you said, you could probably connect it to your wrist. Everything is deeply connected.
Yes, yes. So, and essentially that's just almost like we're stuck in a phase of gates where we are pronating on one foot and supinating on the other. So in some ways we could put the person in the opposite position and maybe feed movement that they don't experience on a regular basis. But in regards to the anterior tilt of the pelvis, when we see the arches start dropping down toward the ground, the knees go kind of knock-kneed for those listening, the valgus position that Dr. Emily's referring to, that's going to cause that pelvis to tilt forward as if it's like a bowl of water and the water is going to start pouring out the belly button. So that's going to create some muscular imbalances, right? It's going to create lengthening on the backside of buttocks, hamstrings to some degree, and the front portion of those hip flexors, quadriceps, even potentially adductors and so on. We'll start to see them getting increase or shortening there. So in regards to the pelvis or the pelvic floor, what occurs to the muscles there? With an anterior, if somebody's fixated, let's say, in an anterior tilt, of course, the organs are going to be shifting forward. The abdominal wall is going to be lengthening. We'll get more spinal flexion. We'll get more compression on the lower back and more lengthening of the abdominal wall. But how does that affect the function of the pelvic floor as well as the diaphragm? I know that's a lengthy question. Sorry about that.
That's fine. No. So I think that it's important to appreciate that muscles are optimized relative to joint position, which I think you would appreciate being someone who likes biomechanics. Yes. Is, maintaining optimal alignment for optimal muscle engagement, which means that if the pelvis has shifted out of its neutral position, anterior/posterior, we're going to get kind of a altered activation of some of these muscles. When you go into an anterior pelvic tilt, it then makes it difficult to engage the pelvic floor. It could be underactive, delayed, not engaging, putting it at a disadvantage, pelvic floor. Because your pelvic floor myofascially blends into the diaphragm, that's ultimately going to influence breathing, and then vice versa, right? So if you're not breathing and your rib cage is flared, then that's going to make it difficult to engage your pelvic floor. For those that are listening that may not have kind of a super deep appreciation for the pelvic floor and its deep connections, because I just want to kind of go through those real quick. So the pelvic floor, which is the base of the pelvis, is an anti-gravity muscle that connects to your diaphragm. Spoke about that, but it actually has these myofascial attachments to your deep hip rotators. For those that remember the gemella and obturator and all of those, quadratus femoris, the obturator internus specifically blends into your posterior pelvic floor, or your levator ani, or your iliococcygeus, but there's a blending in. Then you have deep fibers of your posterior pelvic floor going into your glutes. And then if you go forward, you get deep fibers of your anterior pelvic floor going into your TVA. And then they also blend into your psoas. So it's essentially, and then it goes up to the diaphragm. So you essentially have this spider web of myofascial attachments that are coming out of that base of your pelvis. So if you're tilted forward, and you put a mechanical disadvantage on that muscle, you have a myriad of issues that can start to kind of trickle out to deep hip stabilization, glute activation, joint centration. If you have someone who tore their hip labrum, if they lost range of motion in their hip, if they have snapping hip syndrome. I mean, I could go on and on with things that associate to pelvic floor issues. And it does include the foot as well.
Yes, and they feed one another. So if there's an issue within the pelvic floor, it could feed down into a chain reaction all the way to the foot, up the skull, or if there's somewhere else, it could do just the opposite direction, feed into the pelvic floor. So I love talking this stuff because it's just not only am I getting excited about it, but it leads to so many different directions of conversation here, such as athletic conditioning. So how many athletes are actually going to be perfectly balanced in a world that takes physical movement away from us on a daily basis? You know, you see all the professional athletes entering the stadium and they're on some electronic device. They're wearing a whole bunch of things, one backpack on one shoulder, or whatever the case may be. The point is that there's no one that's going to be perfectly centered and balanced. So
Right.
it is, to what degree are they off balance, and how that is affecting not only their physical form, but their athletic ability. And then when we take it into a gym setting and we try to condition them, the traditional or conventional way is that we're going to assume that they are symmetrical. We're going to do all these bilateral lifts, these sagittal plane bias movements of forward and backwards. And we're going to expect that, yes, they're going to get stronger, of course. They're going to be able to produce more force, but they're doing it with compromised mechanics and with a compromised pelvic floor, perhaps. And now we're going to feed more movement through one hip than the other because that hip is more stimulated in a certain direction than the other. And so back at you, Doc, what are you doing? What do you suggest when it comes to training athletes and how to reduce the imbalances? And do they want to still do traditional lifts?
Yeah, so my approach on this is that you will never get someone to a perfectly symmetrical, like textbook
Yeah,
sample, right?
impossible.
That if we understand that and appreciate that, I don't even know, you're not even born symmetrical. I read, it was a factual research that most babies, when they come out, they push their left shoulder first. So kind of how they're coming out.
This
So
is
they're,
stuff, right?
yeah, so right, we're spiraling through, we're spiraling through the birth canal, and then your head comes out, and then, you know, a shoulder, maybe both, I don't know, but just from your first entrance into the world, let's say if one shoulder comes first, well, now that's already favoring a quasi asymmetry. I had a baby almost a year ago, and I started to notice these asymmetries that would freak me out, knowing like future movement, that we would always change her on one side because it was easier for me. So she would be, her head would be on my left. It's just easier for me to manipulate that, right?
Mm-hmm.
Then I noticed that she would be looking at us while she was in that position, and she would keep favoring, or if they're breastfeeding, they favor one side versus the other. So you're getting these already spiral asymmetries within children, within humans. So that's why I never try to be textbook symmetrical with my patients. However, if there is a shifting in the scales to a greater dominance in that asymmetry that is potentially or is starting to manifest itself in injury or stress, what can we do as coaches or trainers and doctors to just back them off a little bit from it? There's something in medicine and movement that's called the tissue stress threshold. So every tissue in your body has a threshold. That stress threshold, just give it a line or a number or quantify it somehow, that the more that you keep moving towards that threshold, that's where you pass it. You're obviously going to get injured, something's going to break, you'll get an itis. So by doing certain recovery techniques or strengthening one side or uncoiling the client or the athlete in a certain way, you just drop them back a little bit away from that threshold, and you might not actually see physical joint or osseous shifts to the naked eye, but there are subconscious or sensory fascial shifts that have occurred that drop them from that threshold and created a little bit more symmetry. That's why I'm very much into sensory, and I know you love biomechanics, but that's why I've shifted a lot of my passion, fascination, and exploration to the myofascial, neurofascial side of things,
Mm-hmm.
because I've seen osseous or mechanical structure that you would think would move in a certain way, and it doesn't, which means there's something that's overriding it. So that's kind of how I look at it, is I get my patients and athletes to go under the radar. Let's just get you under the radar. And that's where you could have one athlete that has a large asymmetry and they have not had injuries. And then people are like, see, your whole theory is debunked. Like, no. Everyone is individual.
Yeah.
How long have they been training for? What is their genetic collagen? What is their hydration? It's so multifactorial. But that's where I can see certain athletes with some asymmetries might get injured faster than others. And it gets kind of confusing then to the professional of certain theories of symmetry and asymmetry.
We're just going to take a quick pause from this conversation to acknowledge our sponsors, and then we'll be right back. The Zelos Podcast is sponsored by Kinetic IQ, where intelligence meets motion. Kinetic IQ brings a biomechanics lab into the palm of your hand, letting you measure movement anytime, anywhere with just an iPad or iPhone. No wearables required. I've been using Kinetic IQ in my own practice, and whether you're screening athletes, optimizing performance, or guiding return to play, it helps practitioners like us save time, capture more objective data, and make instant actionable decisions. So to learn more about how Kinetic IQ is shaping the future of intelligent movement, visit kinetikiq.com. That's KINETIKIQ.com. At the forefront of Metabolic Elite is Jim Lavelle, internationally recognized clinical pharmacist, a chief science officer at Lifetime, and the co-chair for the American Academy of Anti-Aging Medicine. He's got over 4 decades of experience and has guided Olympic athletes, professional teams, and leading health institutions. You know what makes Metabolic Elite different is their commitment to real results. Like Lipitab, their proprietary solid-state liposomal delivery system. It's a chewable format which enhances absorption like nutrients like BPC 157 and synapses. They're delivered more efficiently in the body, supporting recovery, focus, cognitive health. Their formulas go beyond the basics, solving performance health challenges at the system level. Every product is tested for quality, it's backed by research, and trusted by athletes and clinicians alike. And you can get 10% off all of Metabolic Elite products by entering the coupon code ZELOS, ZELOS. Our goal is to just try to drive them in a certain direction, which is toward symmetry in some ways, and not expect it to reach perfection or permanency for that matter, but just to continually try and guide them wherever they travel, but to always come back to a more central, symmetrical or balanced place. And it's interesting because what we do here too is we tap into the autonomic nervous system in regards to assessing and reassessing to see if they have had a threat response, if it's been hypersensitive to a sympathetic response, meaning that their bodies are going to reduce their range of motion, they're going to be restricted, or their balance will be affected. Even their visual field will be constricted in their periphery. So we actually use these types of assessments in between each movement or each exercise, during the workout itself, to help us determine if the load is proper, if the repetition count was proper. Like, let's have you do something as simple as shoulder flexion, raising your arm up. Give us a general sense of what your range of motion is like. Now let's go do this drill or this activity, come back and let's recheck. If it's presented, like you say, that subconscious excitation of the sympathetic system and it exposed a threat response, then they're going to be restricted. So, I just kind of thought, well, we're doing this with heart rate monitors to find out the proper intensity based on a certain equation. Why can't we use this for every exercise, tap into how the brain is actually receiving, interpreting, and transmitting information based on whatever stimuli comes at them? So I love what you're doing. What you're saying is that, everyone's going to be different and how we respond is going to be different. So we need some kind of markers or indicators for the individual to know are we doing the right thing? Are we going the right direction? Are we working hard enough? Do we need to ease off? Because one day I'll have an athlete come in and he'll be feeling on top of the world and we'll push it hard. And the next day, another athlete will come in and she's feeling on top of the world, but little does she know that there's some underlying threat that's not being registered consciously. But her body, her brain is saying, whoa, we need to slow this down. We need to lighten the load or the intensity or whatever. And we use the brain as a guide, and it's amazing. So sensory, biomechanics, how can we separate them honestly when they're so integrated? Whether it's memory, emotion, physical, spiritual, it all comes back together. And of course, I'm in Santa Cruz, so it's like spin the crystals and use the word holistic, but that's not really what we're talking about, is it? It's actually figuring out that a person is a one whole integrative unit, and that doesn't mean the physical realm only, but everything that we encompass, whether it's the memories. I mean, I'm sure you get this. How about this one? You're working with a patient and you put them in a specific position, and then it strikes an emotional outcome on them where they are just collapsing into tears, or they start laughing, or something is evoked within them because you've placed them in a position. I'm sure that's occurred in some way to you.
Yeah, I mean, I had just one example comes to mind of, it was actually a professional that I was training in my BTS level 1 cert that we do. And we were doing like a myofascial roll to, maybe it was like her tibialis anterior or something like that. And she had, you wouldn't even see a scar, like there wasn't a visible scar on her shin, but we went to do it and she just completely, I'm very empath, so I can feel when energy shift in the room. So I could just like feel that it shifted. And then she told me that she was doing CrossFit and she was doing a box jump and like just ate it. Like she just ate her shins. Yeah. And it was so bad and it was so painful. Like she had serious trauma around this. So doing in a workshop, not near a plyo box, and trying to do like a release technique to her shin, not even on it. She just like, and I had told her, she was like, I just like, don't do that. It's just something that I know that triggers something. So I just don't go there. And I'm like, you could do that, or you could just release why you have that, you're holding on to that. And I'm not a specialist, I'm not a therapist, but I say, you can do it and, just kind of feel safe, and you can reassuring yourself and be in a sensory rich environment and make sure you're doing deep breathing. And like, that's how you get past that stuff. You can see someone or, to help do it. But I just remember that being an example of something that would be in our environment of like, hey, everyone, let's release your anterior tibialis. And then someone shuts down because they were in a fitness setting and they clicked their shins on the box, and you don't know that because there's not really a visible scar. So that's kind of an example of like what you're saying, yeah. Where I feel fitness professionals could encounter that. And if I may add another one real quick with seniors and falls, this is something that I've recently been speaking about that I hope that people can kind of factor in. Whoever works with seniors, and fall reduction training is obviously the huge focus of seniors, or one of the major focus, is if you're training a senior or anyone who has a history of falls, let's say, John Doe fell, he's 80 years old, and you're doing his fall reduction training, you want to ask yourself, what was his experience during that fall? Did he fall and he could get himself up right away? So that would be kind of like a fight or flight, right? So he was able to flight, he could get up. But what about the client that fell and couldn't get themselves up because they either hurt themselves or they didn't have the strength or they didn't have the orientation and they were alone and they couldn't ask for help? Like, what if they were on there for like an hour? Like that would shut someone down. So now you're trying to put them in an unstable situation, and they may completely stop breathing, not like hold the breath is what I mean, right? So they kind of go into a response that you have to make sure that you're not just choosing the appropriate level of balance exercises for a client, but really watch if some of those exercises are triggering them, because then it affects the diaphragm. If I hold my breath because I'm freaking out from a reminiscent of a fall, well, now my pelvic floor doesn't work and my pelvic floor connects to my feet. So technically my balance is not going to be good if my foot to core connection just shut down because I'm not breathing the right way because I want to hold my breath because I'm scared. So that's something of how I try to have people also take this concept.
That's great, because what we're talking about is getting to understand the history of the people that you work with, because they are going to come in and present you as an accumulation of all the experiences in their life. And they have adapted the best way that they could through any of those experiences, but no matter how traumatic it is. And without knowing a person's history, you're really missing out on what you're truly seeing and assessing in real time. So yeah, I'm sure you do like we do. We have a fairly lengthy health history questionnaire or assessment form where I really want to know as early as you can recall. And if you have the ability to ask the parents or whomever that have earlier memories of you before your memories begin, I would like to know as much as possible, because most of the time there are breadcrumbs that are going to lead you back to where they are. And there may be some episodes, whether it's a sensory, whether it's biomechanical, physical, emotional, whatever the case may be, that is going to trigger a new way of moving, a new way of adapting, of living, that we're going to see here. If we can go back in time to that episode, whether it's through NLP or like the Tony Robbins stuff, or if it's actually physical and get them to experience that it's actually safe to do those movements, it was just a one and done kind of thing before, that you've been predicating everything else since then on. And if we can clean all those things up in the past, then it's amazing what will transpire moving on into the future with these people. Mm-hmm. So you're taking it from a sensory perspective. And I guess this is where I want to ask you a question about the sensory mat that you have called the Naboso mat. Mm-hmm. And this is similar. It's for those that aren't familiar, it's kind of a thick rubber that rolls out similar to a yoga mat in some ways, but it has these points, these little points that you would find, almost like diamond shaped or yeah. How would you describe it actually, Doc? How would you say?
So I have, and of course I have my product everywhere. This is not exactly it. This is for something new that we're doing, but you can see, hopefully they can see the little
yes. Okay.
So it is our insoles, our mats, our material, our licensed product, everything has the same 2-point discrimination texture on it. So the little pyramids that you saw, that height of the pyramid and the distance between each pyramid is very specific to stimulate the nerves in the bottom of the feet and technically the palm of the hand. So mats, insoles, material, licensed products, by using them and stimulating the nerves on the feet or the nerves on the hand through a specific texture, we get the response of improved balance, posture, gait, foot awareness, total body awareness, kinesthetic awareness, coordination of movement, stabilization. So it really has this powerful neuromuscular effect through the stimulation of the somatosensory cortex, where the somatosensory cortex in the brain is built around sensory input goes first, and then that sensory input shapes and stimulates or tells the motor cortex how to control movement. Now, when our movement is a little sloppy or a little slower or is lacking coordination and accuracy, you want to think about upticking the sensory cortex through texture, vibration, stretch, things like that, to then provide more shaping of that map in a sense. So we've had some amazing results with our insoles and our mats, from professional athletes to Pilates to general wellness, and then to neuro rehab and senior fitness and fall reduction, and really all of those, because everybody at the end of the day or majority stands up when they move, right? Everyone is walking. That's kind of the commonality of us, regardless of age, is that we walk through the same neuromotor patterns that are shaped from birth to the end.
Yeah. Now, I have quite a few people that I use the mat with just simply taking their shoes off, standing on it. There are people that are living with Parkinson's disease. There are stroke recovery individuals that are trying to get a better sense of balance and movement. And it's actually it's quite remarkable, I've got to say, that as soon as they stand on it, they change their whole demeanor, the muscles that hold them together. There's a subtle relaxation. There's some semblance of tonicity, but not clenching. There is a better sense of balance, and they just love doing their entire routine while standing on the mat. In fact, they typically don't want to get off the mat. They just want to stay on there and do whatever they can, and giving them exercises while they're standing on there. Which would make sense, because like the feet, the hands, and the face are the most densely packed places for nerves on the surface of our body. I've read, I don't even know if anybody truly knows the number, because every time I read up on nerve endings in the feet, I get a different number. It's like how many muscles are in the body, right? It's 3,000. No, it's 4,000. I've heard up to 7,000. Doc, what do you say? How many nerve endings are on the base of a foot?
Yeah, so I mean, it's more, so this is different. So are you talking a myelinated small nerve? Or are you talking a free nerve? So well, that's where I think that you will get hundreds of thousands of nerves, right? I'm sure you've read that. The foot is so important because there's hundreds of thousands of nerves. Those nerves are not mechanoceptors. The ones that actually control movement, there is much less. And I can send you a research study that actually mapped them out. It showed where the SA1, SA2, FA1, FA2, those are mechanoceptors I'm describing, where they're located on the hand, where they're located on the foot. Those we have more like a couple thousand, maybe even less, that has to do with movement. That doesn't mean that the foot is not important or not powerful, but it is. But a lot of the nerves that people are referencing are really, nerves that control sweat glands and, things like that sounds cool, but it doesn't necessarily have an effect on movement, which is why I try to not be very polar in the things that I say. It gets you likes on Instagram, but I would rather have true factual information that is built by science. But yeah.
Love it. Yeah, I would love to read anything up on feet, hands, nerves, and so on. So yeah, that would be fantastic for me. Okay, I got one more question, and then I want to let you tell people how they can find out more information about all the things that you're doing, because it's quite remarkable, and you've been a great speaker for Perform Better, as well as some of the other conferences that I've attended. IDEA, you spoke, I think, last year in Anaheim as well. We missed you on that one. We're at different days and times in our presentations. But in regards to bare feet, we had this whole barefoot movement. Nike took out the Nike free shoes, and Vibrams came out, and all these great shoe companies said, okay, we're going to take away all support. And the next thing you know, everyone's going barefoot. Like overnight, it seemed everyone threw away their shoes. But anything so quickly in the extreme, when you're so used to something else, has a backlash. And so what would you say, being of the Barefoot Academy, how frequently would you encourage people who have been living in shoes for some time to take those shoes off and walk barefoot?
Yes, so this is my prescription or recommendations that I give to all of my patients. And really when I give a recommendation such as this, someone who I don't know their foot type, is I try to have people get 30 minutes, at least 30 minutes of barefoot sensory stimulation every day. That could be walking around your home. That could be, at the gym, taking a yoga class. That could be grounding outside, whatever it is, but at least 30 minutes a day of barefoot sensory stimulation. And that honestly doesn't seem like a lot, but the masses of people, not during COVID because everyone's at home, so hopefully not everyone is in their shoes, but normally, a lot of people will wake up, put their shoes on, spend their day, come home, they still have their shoes on, or they take their shoes off and they wear their house shoes. Like, this is the majority of people, where people who are very into natural movement and barefoot movement, like us, might be surprised that people are not just barefoot at home. I thought everyone was, minimal at home or barefoot at home. A lot of people have house shoes, so they're back in shoes. So 30 minutes every day, and then another 2 to 3 times a week to do at least an additional focused, targeted foot strengthening, barefoot strengthening. That could be in the form of Pilates. That could be in the form of yoga. That could be in the form of any barefoot stuff I have on our YouTube channel, of short foot core, single leg balance exercises. Swing your kettlebell barefoot a couple times a week. Do balance exercises on the Naboso mat. Something, but to do a targeted, focused, barefoot with a purpose, 2 to 3 times a week, 30 minutes.
Perfect. All right. And if people want to learn more about what you have to offer, where can they go?
So I'm on all the social channels. My Instagram is Dr. Emily DPM. Naboso, we're on the social platforms, and then EBFA. So the websites are dremilysplichal.com is my practice. I do see virtual patients. And then Naboso.com is the Naboso technology that we spoke about, the mats and the insoles. And then EBFA is my education company, ebfaglobal.com.
Thank you so much. I don't know how often it is that I actually get to speak to people about feet, but every time I do, I just bring a big old grin to my face, because there's just so much to it, and they remain hidden for most of our lives and most of our world. So thanks for exposing it and bringing some joy to me and to my feet. And I hope our paths cross, whether it's virtually or in person, in the not too distant future. And thank you for the time that you've given us.
Of course. Thank you so much. You'll have to have me back so we can talk biomechanic foot and
yeah. Okay.
And bunions and,
Oh, I'd love to, actually, because we may have to go a little head to head on biomechanics stuff. I would love that. Okay. Thanks again. I appreciate it. And that's a wrap for this episode of the Zelos Podcast. I sure hope you enjoyed this conversation that Emily and I had. If it was a little thought-provoking, you want to find a little bit more information about how the foot behaves up the chain, especially with fascia and human movement, closed chain biomechanics, be sure to check out Parisi Speed School and sign up for our webinar that kicks off in February. Let's hear it one more time for our great sponsors, and enjoy the rest of your week. Remember to check out metabolicelite.co. Check out all the products they have on their website. Synapsin Pro is something I've been using to help stay focused without having to over-caffeinate myself. It keeps me in the zone so I can just really hone in on the things I need to achieve without feeling like, man, I gotta reach for an energy drink every 5 minutes. Metabolicelite.co. And don't forget, Kinetic IQ. They've got markerless motion capture for morons like me. I can use their product with my iPhone or my iPad. I can look at posture analysis, movement analysis of any exercise, gait analysis. It gives me everything I could possibly want when tracking people's movements. So, check out kinetikiq.com.